Hi, I'm Steve Norton Mind Coach and welcome to my latest video blog. Now, I've been asked to do this video today for some guys wanting to understand more about the role of testosterone in mental health and physical well-being. Now, the thing to know about testosterone is that testosterone is what makes men men. It gives us the male characteristics. And when we reach about 40, we start to lose a lot of natural testosterone as our body believes through the evolution of it that we just don't need that amount that we once did when we were in our teens or 20s. So roughly when you get over 40-year-old, you're probably running on about maybe even half the amount of testosterone you once had. And what difference does that make? What impact does that have on men? Well, I think the biggest thing to know is that it can affect your mood, it can cause depression, it can cause a loss in your libido, it can cause problems gaining and maintaining an erection, it can have an effect on your muscle tone, many different things. So I would advise all guys over 40 to get their testosterone checked. Because many times you can be feeling depressed and down and you could be doing all the right things, reading the right books, using the right techniques, and you can still find yourself feeling down. And if your testosterone's low, you could be doing all the right things in the world and you still will not feel any better. Now, when you go to see the doctor, they'll pretty much give you what's called the healthy normal range. And my understanding is that if you're anywhere between 300 and 1,000 on the points chart, well, then you've got what they call normal testosterone levels for your age. Now, the problem is, though, even though you might be in that normal bracket, you might actually still be more towards the 300. Now, if you're more towards 1,000, that's fine. But if you are 300, they may still call you in the normal range and might still say that you're fine, but that still might not be enough for you. So one of the things that you want to be looking at is the possibility of what we call TRT, which is testosterone replacement therapy. And if your T levels are low, you simply do want to be getting things looked at. Problems with physical health can be caused through low testosterone, not just the psychological side of things, the whole mood, the things that are responsible for making you a man start to go down the pan a little bit. So what is TRT? Well, it can be administered in a few different ways, but the most popular ways is either a gel patch that your doctor would administer you with, or you would sometimes take an intramuscular injection, and they would normally be done on either a fortnightly or 3 weekly basis. So you would have an injection that would give you the extra testosterone, and that would very quickly get into your system over a few weeks. And the benefit of testosterone is that you'll find that your muscle tone increases, your strength will increase, not to a ridiculous amount, but you'll be able to recover a lot faster through your workouts. You'll feel a little bit more virile, feel a little bit more younger compared to what you once did. So it's something definitely you want to be looking at. Get yourself checked out. If you've got any of the symptoms such as low libido, struggling to maintain an erection, if you find yourself literally just not even interested in sex, or if you find yourself feeling depressed for no reason, that's definitely avenues that you want to be looking at if you're a guy over 40. So low testosterone is something that does affect ladies too. So if you're a little bit suspicious that you could be low yourself, certainly get yourself checked out too. But testosterone is a thing that a lot of people believe it's almost like a magic cure, and it isn't. It's something that you want to be right with. It's something that you want to be checking on. But it's certainly, you hear more about these days of the abuse of it, especially through self-administration. A lot of people, take far too much testosterone, obviously bodybuilders, for instance, and they'll find themselves with all sorts of side effects. And the most common side effects of testosterone abuse would be gynecomastia, which is inflammation of the breast tissue, and even shutdown of your own testosterone production, shrinkage of the gonads, overproduction of estrogen. So these are things that you want to be looking at side effect wise. So I don't advise self-administration. I would definitely advise go to see a doctor about that, and you might come back completely fine. If you do, that's great, but certainly if you're a guy over 40, get yourself checked out. So I hope that helps. Thanks, and we'll see you in the next video. Oh, and don't forget to subscribe. Okay, bye bye.